Awesome. Hello, everyone that has joined. Thank you for joining us today for this webinar. I would like to introduce Dr. Dawson and Dr. Buzanowksa at River City Sports and Spine. They will be going over a minimally invasive procedure for the SI joint pain. Please type any questions in the chat box below, and we will get to them at the end of the PowerPoint. Thank you and enjoy. Dr. Buzanowksa, I think you're up first.
Yes. Thank you so much, Courtney. And you can go to the next slide, please. So over the next half an hour or so, we're going to be talking about a really phenomenal new procedure for the sacroiliac joint. Very frequently, what we hear from patients is that when they have pain coming from the SI joint, they report they feel miserable. They say that the pain is unbearable, and literally everything makes the pain worse. This is what makes the SI joint different from other sources of pain, is that it's very variable. So there's no one position that necessarily makes it better or worse. So what people tell us is that I have to keep shifting all the time to find a comfortable position, or other things, just nothing really worked for me. Everything that I've done for the pain is good for a couple of days, and then the pain is back. And the pain can be so bad that sometimes literally makes me feel like I want to scream. I was really very surprised initially when I started practicing how painful the SI joint can be. And when people tell me that they're in so much pain, they would literally do anything, I believe it, because I've seen it. To the point that really people's lives change because of this pain. Advance to the next slide, please. In the stories we often daily get from patients is that they've literally tried everything, such as physical therapy, chiropractic care, various interventional options such as epidural injections, radiofrequency ablation, injection even into the SI joint, and then more serious interventions such as spinal cord stimulations, even spinal fusion or opioids. And oftentimes it feels very disheartening to our patients and sometimes to us. Before we started doing this procedure, we were very disheartened and lost really how to take care of our patients, because literally nothing works or nothing really lasts. Let's move on to the next slide, and I'll talk a little bit more about the SI joint, how it works, and why it's so hard to treat it, and oftentimes even why it's so hard to diagnose it. So the sacroiliac joint, as you see in this image on the right side, is the joint between the sacrum, which is the bottom part of our spine, and the hip bones, the pelvic bone. The back portion of the pelvic bone is called ilium, which is what you see labeled in this picture. And where the ilium connects with the sacrum is what makes up the sacroiliac joint or SI joint. So this joint is located between the spine, the entire spine. It takes on the load and motions of the entire spine, as well as your hips. So it's really an extremely important part of our skeleton to keep our spines and our bodies stable. It takes on stresses and motions and in all the pain and degeneration and everything from our entire movable skeleton, so the entire spine, as well as our hips, which are very mobile. The SI joints by nature have to be very, very strong to withhold those stresses. It is also a very large joint, like it's one of the largest joints in our body, if not the largest, I believe. So it is absolutely very much prone to degeneration, stresses, and issues. But because it is such a large joint, it can be extremely painful, and it can also look like many different things. So before we started doing the SI joint and minimally invasive fusions, we were only left with injection to the SI joint, and it is no surprise that those oftentimes were very short-lived in treating the pain. And this joint is not only very important, it has strong ligaments, many different ligaments to keep it stable, but those ligaments, as well as the inside of the joint itself, has a lot of nerve endings. Okay, so when issues start to happen with the joint, it can be extremely painful. Mm-hmm. The other challenging part about this is that we really do not have the same type of accurate testing like we have for some other painful conditions to clearly diagnose this problem. And again, because it connects both with the spine and the hips, it can present like many other things, making it look more confusing. And that's why when we see patients with this problem, they've often tried everything, and also they are at a point where the pain is extremely unbearable and affects their entire function in life. And because this problem is not easy to diagnose right off the bat, what we have found is that SI joint pain is underdiagnosed. Okay, and back in the day, we used to think that maybe 10% of back pain was coming from the SI joint. Now we're realizing that maybe it's more like actually 30% or more, or maybe it's even mixed with a lot of other problems on top of other spinal conditions. So the prevalence of this issue might be even more than that. And next slide, please. So as I mentioned earlier, because this joint is so important in maintaining stability of the skeleton, and the ligaments that are connected to nerve endings are responsible for the stability, as we age, there's natural degeneration of those ligaments, and they can become loose, or sometimes they can actually calcify and harden with age, making the joint losing any of the becoming painful, but also losing the little motion that the joint is for it to be necessary to function. And that can cause instability and dysfunction in how the joint moves and how it affects other parts of the skeleton. In younger patients, we often do see that SI joint becomes painful after some sort of trauma, such as a fall, work injury, car accident, or after spine surgery, because again, the mobility of the spine is changed after spinal surgery. It's the SI joint that has to make up for the lost motion or for the dysfunction higher up in the spine. And in addition, in women who have had children or who were pregnant in their lives, during pregnancy, our ligaments loosen up in preparation for childbirth, and those ligaments do not always return to their perfect tensile strength and elasticity and even their natural strength. So over time, even years later, it is very common for women to develop issues in the SI joint after pregnancy. And again, there's a lot of nerve endings, and those nerve endings are not very big. They're small. So they're extremely painful. They secrete painful chemicals and irritants. And also, it is impossible for us to see them and even treat them effectively with other options. Because they're so small, we don't see them on imaging or any other testing. So as you see in this picture, the pain most commonly is in the lower back, buttock area, but it can spread lower down into the thighs or occasionally even legs, making it look more confusing, making it seem like it's a spinal issue. And the pain will get worse more unpredictably than most other conditions, painful conditions that we see. So again, makes this such an interesting problem and difficult to diagnose initially, because the SI joint pain can be worse with sitting or walking or standing or changing positions, getting in and out of the car, climbing stairs, or even changing position while lying in bed. So this is why when we first started and I said how our patients often present to us, it does get to a point where it truly affects every aspect of people's lives, and it can be so painful and debilitating for our patients. So we're really excited that we have partnered with PainTEQ and are able to provide this procedure for our patients, because it is extremely effective. And I'm going to turn this over to Dr. Dawson right now, who's going to explain to you how we perform this procedure.
Thank you, Dr. Buzanowksa. She's done an excellent job at presenting some of the challenges of how patients with SI joint problems present, the treatment options that we currently use, and whether or not they're effective. And the effectiveness typically is short-lived, and some of the lifestyle issues that SI joint can present. And so, like she mentioned, we're excited about partnering with PainTEQ and discussing the LinQ system with you today. So I'm going to review some of the surgical aspects of it. So it's a simple, minimally invasive procedure that can provide effective long-term results, especially from what we've witnessed in the patients we performed this in. It's an incision about 1 inch long, same-day outpatient, so no hospitalizations, no need to pack a bag and stay for extended periods of time. We don't involve any drilling or placement of any screws in the joint. It's pretty safe, very safe in the fact that there is really minimal complications or significant risk of infection. And the recovery time is very quick. And you can see at the bottom right of your screen the diagram illustrating the size comparison of the implant to an almond. So pretty tiny and small. Next slide. And so what is the allograft made of, right? We do this procedure, you want to know what is going into your body. And so the implant is made of cortical bone. So if you look at the diagram on the left, you can see that the cortical bone is the hard outer shell of the bone, and then you have the cancellous bone, which is a soft kind of spongy bone in the middle of everybody's bone that we currently have bones. And so if you look to the right now, you can see the implant sort of built like a spaceship for its innovative, stylish look. It's a big window, and within the big window is where we get the cancellous bone, or the DBM putty that you see. So the DBM putty is made from cadaver bone that has been sterilized, and we mix that into that window during the implant. Next slide. So how is the procedure done? So we're going to watch a short video, and then I'll tie up any loose ends related to that.
PainTEQ's LinQ is an innovative way to solve patients' SI joint pain, using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinmann pin is inserted into the SI joint, between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the broach rasp is inserted to create room for the LinQ allograft to fit comfortably and at the same time initiate decortication. The brooch and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the LinQ allograft is filled with DBM and placed into the SI joint. The inserter ensures that the LinQ is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for LinQ to work. LinQ enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
And so we just watched a short video illustrating the procedure. Now, most patients want to know, is this going to hurt? So the first thing we do in preparation for putting the Steinman pin, which is a long guide, into the joint is to numb up the skin, the muscles, any tissues that are going to be used or targeted in the trajectory of that pin going into the joint. Patients are anesthetized, and they also are given moderate sedation, meaning that you're breathing on your own. We do not have to put any tubes or do general anesthesia for this procedure. The procedure typically takes about 20 to 30 minutes to perform, and it is done very safe and is, as previously stated, a very good procedure from the standpoint of minimal infection as well as pain associated with performing the procedure. All right, next slide. And so what should you expect after the procedure, right? You've come in, we've given you some conscious sedation, performed the procedure. 20, 30 minutes later, we're back in the recovery room giving you discharge instructions. And so now we're going to talk a little bit about the aftercare. So the first thing we're going to talk about is, when we make incisions, we want to be really, keen on making sure the wound stays clean to eliminate any risk of infection. So for the first 72 hours, we don't want you to get the site wet with any water or any abrasive materials at all. We typically keep it clean and bandaged, but after 72 hours, you can then go ahead and proceed with gentle washing of the wound and monitoring for any skin changes. From an activity standpoint, we want to make sure we give the graft and implant time to do its magic, right? So we don't want to get out and start aggressively doing things because we might be feeling better, in the first few weeks for following this procedure. The majority of patients feel better by the time they come to see us for a wound check in 1 or 2 weeks. And so we want to limit the restrictions of lifting, bending, repetitive twisting, crawling, using stairs, those sorts of things. If you're an avid athlete, you want to really minimize your activity level to walking and stretching and avoid things that are a little bit more medium to high impact, such as running, playing golf, which involves a lot of twisting motions on the spine and the pelvis. And then, like I said, the recommended activities, walking is tolerated. Now, we do mention restrictions on swimming, but walking in water, those sorts of things are typically okay once you've been given a green light from your wound standpoint, but no active swimming right now. Next slide. And so, we've done over 100 of these procedures. And to the left, one of my patients who had a lumbar fusion surgery and was in pain for 2 years and could only sit for about 45 minutes. So after we did his procedure on the left side, followed by the right side, he was able to sit for 7 hours and actually travel and get his life back. And he told me that I changed his life. And Dr. Buzanowksa has a patient moment to share.
So yeah, same experience for me and my patients. This wonderful patient, Mrs. Treadwell, she was having a lot of issues with her back, and she ended up having surgery for her back, and the surgery helped a lot of her pain. But then as the time went on, she came back saying, my back pain is back. And why is it? Did my surgery not work? What happened? And what happened is that she had two issues. She had the SI joint issue and the back issue. And as she healed from the first problem, then she started to compensate less for her spinal problems, and her previous SI joint issue unfortunately flared up more. So we ended up doing SI joint fusion with this PainTEQ device, and her back pain was completely gone, and was gone years later. It's gone now, a year and a half later. So we were really amazed by this.
Next slide.
Next slide.
Before the link.
So we're going to go to some frequently asked questions. And so first of all, does this procedure require overnight stay? No, it's an outpatient in and out, and patients feel better essentially immediately as soon as they wake up from the procedure. It is covered by Medicare and most insurances. If you had previous spinal fusion, like my patient did, yes, absolutely, very much so, you're a candidate for this. Similarly with other injections, procedures, or anything else you've had done, this can absolutely be done and help you regardless.
All right. And can I still have MRIs or CAT scan imaging studies if necessary? Absolutely. This device is not contraindicated for the use of MRI or magnetic resonance imaging or CAT scans. Will I get immediate pain relief? Our experience is within the first week, patients are doing significantly better compared to prior to the surgical procedure. And patients do experience some soreness, but typically the majority of them get pretty good, immediate, noticeable relief after the procedure. Now, what if you have pain on both sides? You're dealing with, structural, inflammatory, arthritic SI joints on both sides. And each patient is different. We do have patients that we have just in that scenario, and you may be one of them. But the main thing is to ensure, one, we have the right diagnosis, that you are the proper candidate for this type of procedure. And then once we have done that, then we will treat one side at a time, because we find in most experience that the patients tend to experience better recovery, faster recovery, and less pain by targeting one side at a time.
But both can be done. And both are done with just a little bit of a few weeks in between. And I was just going to add that about pain relief. While people may experience soreness from the actual procedure itself, that their previous SI pain is gone, usually, oftentimes immediately.
Yeah.
So, okay. So we're going to open this up for questions. If anybody had any question, typed it in the chat. We're happy to answer them right now.
Yes, we will give it a couple minutes. The chat box should be on the bottom of your screen. And when they come through, we will ask, and I will let the doctors answer.
All right, sounds good.
Courtney, is that the only way to ask questions? If somebody raises a hand, can they still, or no?
They cannot speak, and the patient's questions cannot be seen by anyone else.
Okay. So if anybody's raising their hand, please type your question in the chat box.
Okay, we have a question. How long between procedures for insurance coverage?
And so that depends on the insurance plan you have. If we were focusing on Medicare, you can do the opposite side within 2 to 3 weeks after. For us, it's just a matter of making sure that the initial side has healed up and the patient is doing better before we take them right back into surgery. And so that's typically what we do. Other offices may do things a little differently, but each insurance will have its own guidelines and rules as to when you can do the opposite side as far as in relationship to a second procedure.
And we're going to record this and post this webinar on our website. It will be available to you and everyone else to rewatch and ask us questions in the office. We'll look at your particular situation, see, you know, if you're a candidate, and if you have any reservations or questions at any time, let us know. Again, we've had excellent results. I am amazed, like nothing else almost in pain, in the world of pain management. So we're very excited to offer this to our patients. Again, any questions, please let us know.
Yes, we have another question. LinQ versus Vertiflex, are they both equally effective?
So LinQ and Vertiflex are both excellent procedures, but they treat different problems. So Vertiflex procedure treats neurogenic claudication related to a pinched nerve. So it's a different problem than SI joint. The SI joint, I don't know if you can see this, but the SI joint, again, is the joint here. A pinched nerve is higher up in the spine where the nerves are traveling. So different types of treatments for different problems.
Okay, I have another question. Are patients always put under? I have had a few surgeries and I'm now quite frankly scared of surgery again.
Yes, a very good question. And for us, we do not do general anesthesia. So you do not have to go fully under. We give patients either Versed or fentanyl, you may be familiar with, or propofol during this procedure. So you do not have to be under general anesthesia. We do moderate conscious sedation, meaning that you're given the medication, but your body is still in charge of breathing.
Okay, what can I expect for recovery?
Recovery is, again, very minimal. It's not like surgery. You're not laid down. You're not, you don't have to be stopping everything in your life. We just want you to be cautious. Okay, so those precautions are with regards to your activity and with regards to the wound care. You would have, you would receive pain medications for the surgical part of, for the post-surgical pain for 5 days in antibiotics, but all your regular activities you can continue, keeping in mind those precautions: bending, lifting, twisting, and no vigorous activities. But essentially you can continue your life pretty much normal unless, you know, you do those strenuous activities as part of your daily life. You don't need anybody to take care of you after the procedure. And again, pain is not a problem because the SI joint pain is pretty much gone right away, but the surgical pain from the incision, as that's healing, you'll get pain medication from us to take care of that. So it's very easy.
Yes, and what we typically find is a week after the procedure, all patients come in so we can take a look and inspect their wound. And the majority of patients who have SI joint pain and problems on both sides are asking us, when can I get the other side done?
Yeah.
And so it's a very effective treatment tool. And we've been extremely, happy and surprised at the amount of success that patients report to us after performing a procedure in them.
Okay, I'll take a couple more questions, but does it ever move or do you have to replace it?
So the implant does not move and we do not have to replace it. And the part of the reason is that the purpose of this is for it to kind of fuse. Okay, so as you may remember from the slide that Dr. Dawson was showing the implant has a opening inside filled by a substance that mimics the soft spongy part of the bone. And what that does is it stimulates bone growth through that hole. Okay, and that's where the fusion occurs. So, so that's another way that this procedure actually adds stability and strength to your SI joint. I have never seen or heard of this ever moving. Now, is that possible? Anything's possible in nature, but I don't think it's ever happened. Courtney, have you seen it in other practices where the implant ever dislodged or?
I have not, and we've had patients, unfortunately get in car accidents afterwards, and the implant is still in place via confirmation of like CT scans. So it's very hard for this implant to move once it's in spot.
Yeah. Do we have any other questions?
Yes, and can you just, I think Dr. Buzanowska touched on this, but can you just share again where they can find this webinar if they would like to rewatch it or send it to someone?
We're going to post this on our website, rivercitysportsandspine.com. If you click on patient education, you're going to find our webinars on many different topics. So maybe, I'm guessing maybe in about a week, this should be available online. As soon as we get the recording from Courtney and her team, we're going to send it to our team, and this webinar is going to be available online.
Yes.
All right, well, we don't have any more questions as of now, so we can wrap this up. Thank you, Dr. Dawson and Dr. Buzanowska, for sharing this therapy. And if you have any questions, feel free to reach out to myself, Courtney, Corey, or the office. Both numbers are listed on this last slide, and we can help you get in the right direction. And have a great day.
All right.
Thank you.
Thank you.